Here at Callaway Community Hospital, the UbiDuo came into service here about 4 years ago. Prior to that, I was an emergency room staff nurse for about 22 years. In that 22 years, I've dealt with a lot of hearing impaired patients, and in that time we've always had to rely on the service of actual interpreters to provide interpreting service for us with that patient population. The problem with that is that, like here at Callaway Community Hospital, our interpreter contract is with a service that's about 40 miles away from here. And so there is a significant time delay between the time that interpreter arrives and we get definitive service to that patient. And so we rely on writing notes back and forth, and a lot of times that's not possible because of the different circumstances that the patient may be in at the time. I was here for the first 2 years of my tenure here as a staff nurse in the ER, and we operated the same as I just said. We'd have to call for an interpreter and wait a significant amount of time before the patient would even agree to communicate with us. Four years ago, we purchased our first UbiDuo, and I was amazed at how easy it was to use, how efficient it was when we communicated with the patients. It was very easy for us to write and answer questions back and forth with one another, and it was easy for our physicians to use and as a way for them to provide care for our patients. Since that time, I've become a big advocate for that system. I think it's a tremendous asset to the hospital. I think it's an asset to our patients. As a service for the patients, it's right there, it's readily available. There's no wait involved for interpreters. Unless the patient is immobilized for some reason, the system works on virtually just about anybody that comes into our hospital. And it is the interpreting service for our hospital. The only time we use an interpreter now is if they are immobilized or incapacitated to a point that does not allow them the ability to type on a keyboard. So we always have that option, but again, we're talking about an hour to 2 hour delay from the time we call for an interpreter until they arrive at our hospital. The UbiDuo is right there, it's handy, provides immediate access, and it increases the time in which we can provide that definitive care to our patients that are seeking that. So from an administrative standpoint now, there is a huge cost benefit with the UbiDuo. Okay, there's a one-time price up front that we paid for the system. We did that, we have it, it's done. The contract with the interpreter service is expensive. There's a minimum amount of time that we have to pay that interpreter, whether they're here that long or not. And it was costing us literally thousands of dollars a month. So I made the decision to go to the UbiDuo as a full-time service for our hearing impaired patients, and it's turned out to be fine.